Well, we're joined now by the Health Minister, Stephen Kinnock. And Stephen, we will get to NHS and health in a moment, but I did just want to finally ask you one more question about what happened yesterday in the Commons. Do you think putting Rachel Reeves in front of the cameras today will allow her to recover from this? Do you think this puts the matter to bed?
Well, I was at the launch event this morning, and it was great to see Rachel there. She was on absolutely great form, and it was right for her to be there and talking about the decisions that she has made as Chancellor, which have enabled us to invest this £29 billion in our NHS, and that is going to be the foundation of the 10-year plan that is going to revolutionise health and care services in our country. So it's absolutely right that Rachel is there, because she is a vitally important part of what this government is doing to get our NHS back on its feet and fit for the future.
You talk about decisions made, but wasn't it the wrong decision of somebody to allow her to go into the chambers and sit there in front of the cameras? And she herself today has said, you know, we all have bad days. I certainly know how she feels. Sometimes I feel like bursting into tears and I have to be on the telly too. But shouldn't somebody, perhaps not the Chancellor, have stepped in and said, hang on, you look awful, you've clearly had, you know, something awful has clearly happened. You know, let's forget you're not sitting on the front bench today, you know, go and take some time out this afternoon. Isn't that a failing of the government, that nobody stepped in to help her and stop this?
Well, the Chancellor of the Exchequer wants to be in the chamber for Prime Minister's questions, shoulder to shoulder with the Prime Minister, and putting the government's case to the people, and also, of course, dismantling so much of the ridiculous stuff that we hear from Kemi Badenoch and her team. So I think it's absolutely normal for the Chancellor of the Exchequer to be there. Clearly, there were some personal issues, and Rachel was upset, and that came through as the Prime Minister's question session went on. But as she rightly said, people do sometimes have a difficult day at the office. The difference is that when you're in politics, that's all in front of the cameras. And I think what she's also said, and rightly, is that she is now cracking on with the job. The Prime Minister has said that she will be the Chancellor of the Exchequer for years to come. She's doing a fantastic job. The government is behind her. The Parliamentary Labour Party is behind her. And we look forward to working together with our colleagues in the Treasury as ministers in the Department for Health and Social Care to now get on and deliver this 10-year plan that's going to revolutionise health and care in our country.
Well, tell us about this 10-year plan. How is it going to work? What difference is it going to make? Because there's already been quite a lot of criticism of it, that, for example, one of the big problems is losing staff. There's nothing on here on retention, on pay increases. You're hemorrhaging GPs. How are you going to keep people in the NHS for the next 10 years?
This plan is based on three seismic shifts. A shift from hospital to community, a shift from sickness to prevention, and a shift from analogue to digital. Hospital to community, we're going to have neighbourhood health centres, multidisciplinary teams with doctors, nurses, pharmacists, mental health workers, physios, adult social care, palliative care, coming in as a one-stop shop for the patient, rather than constantly having to refer patients to overloaded and overworked
hospitals. Is this like going back to the era of the sort of the community hospital that we used to see?
I think it's going forward into a new era which goes beyond just the health issues that a person might be facing. It's also the wider determinants. So, for example, if you look at something like social prescribing, which we want to have in this multidisciplinary team, which is also looking at other issues that people might be having in their lives in terms of work, in terms of where they live, in terms of other pressures they're facing, mental health issues. These are modern 21st century issues where you recognise that there are wider determinants sometimes of people's health conditions. The other major shift, of course, is from analogue to digital. We are going to revolutionise the NHS app so that it is much easier to do bookings. We're going to have a single patient register. We're going to enable people to self-refer rather than constantly having to go through the GP when that's not necessary. And then, of course, from sickness to prevention. So many issues in our society are based on things like obesity, smoking. Healthy lifestyle is crucial, and we're bringing forward policies to make the healthy choice the right choice and the easy choice. And as we shift from being an NHS which only deals with sickness to an NHS which is actually about prevention and about healthy life expectancy, we will see that the demand for NHS services will drop because people will be living healthier lives. And that is how you get better productivity and better results, better patient outcomes right across the board.
You talk about social prescribing, but the one thing that this doesn't mention is social care. And this is the big issue, isn't it? The problem is that all of the NHS is rammed full of people who really should be receiving social care elsewhere, but instead they're blocking beds. Doesn't this 10-year plan need to address social care?
Well, adult social care will be an integral part of the neighbourhood health service. That's what we want to see, is a primary and community care and adult social care coming together in these neighbourhood health centres. 200 neighbourhood health centres. Every community of the country will benefit from that move and the from that shift, I should say, and the adult social care piece in that jigsaw puzzle will be absolutely vital. On adult social care, of course, we have hit the ground running. We've legislated for a fair pay agreement for adult social care workers. We've uplifted the disabled facilities grant for home adaptations by over £700 million. And of course, the biggest uplift to carers allowance since the system was set up in the 1970s. So there's a lot that's happened already in terms of immediate steps that we're taking. But of course, looking at the longer term future of adult social care, we have the Casey Commission, Baroness Louise Casey, known as someone who is not backward in coming forward. She will be providing the government with some very strong and robust recommendations about how to fix adult social care in our country after 14 years of Conservative neglect and incompetence.
Stephen Kinnock, Minister of the State at the Department for Health and Social Care, thank you very much for joining us.
Thank you very much.